Hello, my friends. Dr. Ken Berry here. This video today is going to be just for people with diabetes, or if you love someone with diabetes. There's so much confusion out there, and there's a new article that I want to share with you that adds to this confusion. The confusion is, what should my A1c be to be safe? Now, we know from much research that the lower your A1c is, the lower your risk of diabetes complications, whether you're type 1 or type 2. I found this article in the New York Times, and you may not read the New York Times, but even if you don't, 11 million people do every day. And there's a new article that I want to share with you and go over and explain to you where this comes from and how you need to understand this and why you can safely ignore this article. So this is the article from the New York Times: why older people may not need to watch blood sugar so closely. Now, if you watch this channel, you know that I want you to watch your blood sugar very, very closely, because the better your blood sugar, the better your A1c, the lower your risk of diabetic complications. Nobody wants diabetic complications. So why would they have this article written in the New York Times saying, oh, you probably shouldn't watch your blood sugar so closely? The subtitle: Intensive Management of Diabetes Pays Fewer Dividends as Patients Age and Raises the Chances of Hypoglycemia. That's low blood sugar. But many people have not gotten the message. This is written by Paula Spann, who's actually been a journalist for the New York Times for years. She's written a couple of books, and she also teaches a journalism class at Columbia. I think she's a very good author and a very good reporter, but she didn't get the full story in this article. So it starts with watching a single person with diabetes live, Miss Ora Larson, having a low blood sugar episode. Says she has several episodes like this each year, seem to be becoming more frequent. And then it goes on to explain hypoglycemia occurs when levels of blood sugar or glucose fall too low. A reading below 70 milligrams per deciliter is an accepted definition. Accepted by whom? If you follow this channel, you know that I want I love it when your blood sugar is 70. If it gets below 60, then we'll talk, because of the way that I teach you to manage your blood sugar, which this article should have went into, but definitely did not. So it is true that hypoglycemia occurs more frequently at advanced ages. If you've been a diabetic for years, you've probably had at least one episode of hypoglycemia. It's very scary. It's also very dangerous. I agree with all that. Ms. Larson's endocrinologist and her primary care doctor worry about her having low blood sugar episodes because it can increase your risk of falls, broken bones, heart arrhythmias, and cognitive damage. All true if you're managing your diabetes a particular way. Not true if you're managing it the proper way. So both of them have advised her, her endocrinologist and her primary care doctor have advised her to let her A1c be above 7. Now, if you follow this channel and you're like, what? Why? So this all started back with the Accord trial back in 2008 was when it was published. They used very intensive medication therapy to tightly control diabetics' blood sugar and A1c. The main things they used were insulin and the glimepiride, glyburide, which work by, so insulin works by actually injecting insulin into your body. The sulfonylureas work by forcing your pancreas to produce more insulin. And then they also used another drug extensively in that study, which has since been pulled off the market. So if you are managing your blood sugars and your A1c with aggressive pharmaceutical intervention, then you have to worry about everything that's talked about in this article. But we're moving past that now. Millions of people are using a low carb, keto, even a carnivore diet to completely control their type 1 diabetes or to completely reverse their type 2 diabetes and not even have to take any medication. In that light, hypoglycemia ceases to be a concern at all. But this article, written for 11 million people, and you know there will be knockoff articles written in other newspapers and magazines and websites, because that's how modern journalism works. One person writes a piece and everybody else copies it, changes a few words. And so this patient in this article is using Victoza and injects it 3 times a week and watches her diet. And so that literally is the only time the word diet is mentioned in this article. There is zero mention of a low carb diet. There is zero mention of a ketogenic diet. Now, why would I bring that up? Why does that even matter? Well, it matters because when you ask ChatGPT, you can verify this yourself. What's the most studied diet for diabetes control and reversal? It's a low carb diet, a very low carb ketogenic diet, a keto diet. It has been studied more randomized controlled trials than any other dietary intervention on the planet. And more research is coming out every day showing that if you have type 1 diabetes, you can have a normal A1c and normal blood sugars and inject very little insulin. Now, when you inject very little insulin, guess what? You are at much lower risk of developing hypoglycemia. If you're a type 2 diabetic, you can use a low carb diet, a very low carb ketogenic diet, a ketovore diet, or a carnivore diet to completely reverse your type 2 diabetes so you don't have it anymore and you don't have to take any medication at all for it, thus obviating any fears of a hypoglycemic episode. Hypoglycemic episode in the face of diabetes occurs only when you use too much medication and then don't eat enough carbohydrates to match your insulin or the other medication that you're using. So now back to this article. You would have thought, since obviously low carb, keto, carnivore is the most popular dietary strategy on planet Earth right now, how many Instagram channels and TikTok accounts and Facebook posts are there about low carb, keto, carnivore, and reversing type 2 diabetes or thoroughly managing type 1 diabetes with minimal insulin use, in some cases 80% less insulin? So even this patient, so the article says, so when her doctors recommended a higher A1c, she resisted. She said, I think it's a bunch of hooey. It didn't make sense to me. But it doesn't make sense to me, madam. I agree with you. She got a lot of encouragement and recognition from her physicians for controlling her diabetes, staying on top of it. That's because it's uniformly a good thing to do. Now, one of the main points of this article is as you get older in your 70s and 80s and beyond, the risk of hypoglycemia from intensive pharmaceutical management outweighs the benefit of having a normal A1c or having a normal blood sugar. And in that iteration, I agree. You shouldn't use aggressive insulin and aggressive glimepiride and glipizide and glyburide. I 100% agree with that. You should not do that in people over the age of really 50, but we no longer even have to do that because we now know that low carb, keto, carnivore diets, the most studied dietary intervention for diabetes, makes these drugs unnecessary. But they're not mentioned a single time in this article. It goes on to say the American Geriatric Society called for a hemoglobin A1c goal between 7.5 and 8. Can you so even if you're 70, 75, even 80, are you dead? Are you ready to lay down in the pine box? Most of you would say, hell no, I'm not dead. I want to live. I don't care if you're 80, if you're running around with an A1c of 7.5 to 8, your chances of losing a toe, losing a foot, losing kidney functions, going blind are 10x. 10x what they would be if you were controlling your type 2 diabetes with a very low carbohydrate diet and no medication. Then you can safely get your A1c down under 5.7, thus putting your risk of diabetic complications back to the baseline of what just average people in the population. They don't have a huge risk of losing a foot or a leg, of having to go on dialysis, of going blind, of having just a terrible skin infection that won't heal even with antibiotics. You, as somebody with diabetes, you don't have to suffer that either if you'll just try a low carb, a ketogenic diet, a carnivore diet. Try one of those iterations of a very low carbohydrate diet. You can wean down and stop your diabetes medications if you're a type 2 diabetic. If you're a type 1 diabetic, you can inject 50, 60, 70, 80% less insulin, have a much lower risk of developing hypoglycemia. And if you're a type 2, you're not going to ever develop hypoglycemia again for the rest of your life. And you could literally add 10 years to your life. Now, if you ask the average 80-year-old, hey, would you like to add 10 years to your life? Most of them are going to say, yeah, especially if their health span is keeping up with their lifespan. So relaxing aggressive treatment can involve stopping a drug, lowering a dose, switching to another medication, an approach called de-intensification. I would only recommend you do that if you've adopted a very low carbohydrate diet. So then they talk about Ozempic, of course, they have to put that in. If Big Food and Big Pharma were to get together and ask the New York Times, hey, I want you to write an article so that people will still eat lots of junk food and still use lots of pharmaceuticals. We're not going to talk about keto at all, but that's the article. And so we're going to relax the A1c guidelines, and you can eat whatever, and just it doesn't matter if your blood sugar goes to 210 after you eat. That's no big deal. This is the article, even though I don't think that this author intended that whatsoever. She fell perfectly into the trap that Big Food and Big Pharma have been setting for decades to say, so you don't need perfect blood sugar control. You want to take several pharmaceutical medications. You want to eat just whatever, eat the rainbow, eat all things in moderation. That's what, even though I don't think that was her intention, that's exactly what this article leads to people thinking. So if somebody who didn't know what I know and what longtime viewers of this channel know, if they read this article, they'd be like, so I can just have an A1c of 7.6, 7.7. That's totally fine. I maybe can even stop a medication and eat, watch my diet. That's the quote from the article, watch my diet. With no words at all given to what diet should you eat. Just watch your diet. What the hell does that even mean? So this article is part of the reason that people think, it's fine to have an A1c of 7.2, 7.7. It's totally fine. My doctor said it was fine. There's the position statement from the Geriatric Society, the American Diabetes Association. They all say this is fine. What people need to understand is that all these associations take millions of dollars a year from both big food manufacturers and big pharma manufacturers. This is the reason so many people with diabetes are confused. They get all these confusing messages. They've been told for years by their doctors, you want to have as low an A1c as possible, which is absolutely true. But then they're also told, eat, Mediterranean, eat plant-based, whole grains, fruits and vegetables, fruit juice smoothies. You can never have a normal A1c eating those foods, drinking fruit juice smoothies, you drinking fruit juice, fresh squeezed fruit juice. You can never have a normal A1c as a diabetic doing those things. And so then they turn to the pharmaceuticals and they get their A1c down. But if they're too aggressive with their medications, then they have low blood sugar episodes. They fall and bump their head, fall and break a hip, fall and break a wrist or an ankle. They fall and get a subdural hematoma. Bad things happen if your blood sugar dips too low because you're using pharmaceuticals too aggressively. So the solution for this author and all of the billion-dollar corporations that I don't think had influence on her writing, but effectively, she's writing right into their hand is, don't worry about it. Eat the rainbow, keep your A1c 7.5-ish. That's fine, especially if you're 65, 70, 75, 80. You don't want to have too tight a blood pressure or blood sugar control. This is provably false. You don't want to have too tight of a blood pressure control injecting insulin or using glyburide, glipizide. Absolutely true. They're going to cause you to have low blood sugar episodes. You'll fall and hurt yourself, or you'll wreck the car. You sure don't want to have the keys taken away from you. What I implore you to do is to look into a low carbohydrate diet, a very low carb ketogenic diet, a ketovore diet, or a carnivore diet, so that you can reverse your type 2 diabetes and it'll be gone forever. And you can throw all the pharmaceuticals in the garbage and never have to worry about a low blood sugar episode again. If you're type 1, adopt one of these very low carbohydrate diets and you'll inject 50, 60, 70% less insulin. You'll have a much lower risk of having a hypoglycemic episode. You'll have a much more normal A1c, and you will slash your risk of diabetic complications. Not sure why this author didn't talk about the most researched dietary intervention for diabetes, but she did not talk about it at all. If the author happens to watch this, I'm happy to do an interview with you as a board member of the American Diabetes Society. I'm happy to do an interview with you, not necessarily rebutting this, but just talking about seniors over the age of 55, 60. They need to adopt a very low carbohydrate diet. That way they never have a low blood sugar episode. They also never have any of the disastrous complications that come from having an A1c of 7.5. They also never suffer from the potentially disastrous side effects of taking modern diabetes medications. Now, I hope this video helped you a lot. If you know somebody who suffers from diabetes, please consider sharing this video with them. And also, if you need group coaching and you need a tribe of people who can help you reverse your type 2 diabetes, or who can help you achieve a normal A1c and use 50, 60, 70% less insulin as a type 1 diabetic, consider joining our community. We've got hundreds of people in there who have reversed their type 2 diabetes and keeping it reversed. We've got several people with type 1 diabetes in the group who have normal A1Cs and use way less insulin than they used to. Thanks for hanging out. Thanks for sharing this video. This is Dr. Berry. See you next time.